Good morning, Norman. How are you going?
I'm fine, Lisa. Hi, Michael.
Hello.
We got the news just in the last few hours that second Pfizer batch had arrived last night. It does feel like there's a certain momentum here.
Yeah, we're getting going with that first, that high priority group. And, if you did nothing else, that's the group you've got to get to. You've got to get to hotel quarantine workers, border workers. You've got to create that ring of confidence around people who are coming in from overseas. Ideally, actually, but it's not part of the vaccination program, you'd also immunize with the Pfizer vaccine their household contacts, in other words, people they live with, to really add an extra layer of insurance. But it's great news that it's going.
Okay, and lots of excited talk about what this means potentially for the opening up of borders and travel down the track. How do you read it for the rest of this year?
Well, just very briefly, in November on the Health Report, I had one of the leader of one of the best modelling groups in the world predicting what was going to happen in 2021. And his name's Chris Murray, and he predicted the downturn that you're seeing in the Northern Hemisphere, dramatic downturn in cases. And his argument was that was independent of immunisation, that was seasonality, that it really would start to burn itself out with the winter surge. But when I re-interviewed him for last night's 7:30, he was less bullish. For two reasons, and this is the Northern Hemisphere. One is human behaviour changing ahead of the vaccination, and you notice that Boris Johnson is slowing things down in terms of reopening. And the other is the variants. And he is worried that in the Northern Hemisphere you may see a third wave in the northern spring, which is pretty depressing. That's just one of their scenarios. In terms of Australia, the worry is the variants. The good news out of Britain again, that both the Astra vaccine and the Pfizer vaccine prevent hospitalizations and severe disease. That's really good. And as we said last week on the show, what this year is about is turning COVID-19 into the common cold. And and so that we're protected against that, and both vaccines will do that. However, if you want to open up borders, you've got to have vaccines that are strong, potentially strong against the variant. And the news with the Astra vaccine is not good, at least from a study in South Africa, which showed it was only 10% effective for mild to moderate disease with the South African variant, more effective with the severe disease. So we've got to be planning now for what boosters we're going to get this year, ideally with something like the Pfizer or Moderna vaccines, which will give us strong immunity that have been retooled for the new variants and get them out. So we cannot rely on the Astra vaccine to open up borders. We can to make us safe. I'll be getting it, and I'll be delighted to get it, and I encourage everybody else to get it, because the faster we get immunized, the less likely it is to circulate. The other thing that has to happen is that low-income countries must be immunized. This is not some do-gooding thing. This is a selfish act on our part, because as the virus circulates, more variants spin off. We've got to get the whole thing slowing down globally so that there are fewer variants, and that's the time we can really think about opening up.
Hey, did you get any feedback, Norman, about how things went yesterday, whether they got through the numbers that they were hoping to get through?
I think it's too early to really find that out. I think that what's the real test of the system is not where you've got this controlled system with hotel quarantine workers, employers putting people forward. I think it's the next stage when people, what's the app that is going to be rolled out in terms that you can register to come forward. It's not going to be, as far as I understand it, like Israel with really good electronic health records, which we don't have, of contacting people, of having texting for people to come forward. It'll be us coming forward, and it's whether GPs are tooled up for that yet. Hopefully they will. I think the next stage is the test.
Yeah, all right. Thank you so much, Norman. Talk to you soon.
You're welcome.
Thanks, Norman.